Hi, my name is Joanna Chikwe. I'm Professor and Chairman of the Department of Cardiac Surgery at Cedars-Sinai in Los Angeles in the Smith Heart Institute, and I'm also the Editor-in-Chief of the Annals of Thoracic Surgery, the official journal of the Society of Thoracic Surgeons. The Annals of Thoracic Surgery has always been described to me as the go-to journal for CT surgeons. It's the journal that we all want to read because it really informs our practice and how we think. More people in our specialty read the Annals than any other journal, and the impact factor, so that's the number of times each article is cited on average, is now the highest in our specialty. So this is the best platform for your work to get in front of your colleagues. Our record impact factor of 5.3 really speaks to the quality of the research being published. We get over 3,000 submissions a year. We only publish 15 original research articles a month with a lower than 10% acceptance rate. So the bar is really high, and it's really rewarding to see that reflected in this highest ever impact factor. Editor's Choice contains 8 or 9 of the most important articles, or the most interesting articles in each month's issue. That's usually 1 or 2 consensus guidelines, the highest impact research, occasionally a really great case report. The kind of work that we think is really important is randomized trials, sometimes single center series with great follow-up, often focused on areas where we struggle as surgeons, where the outcomes aren't what we want, that are really geared to help us understand what we can do to achieve the best results for our patients, short and long term. The Annals Peer Reviewer Academy is an exciting, year-long investment in the future of academic cardiothoracic surgeons who are willing to give their time to do peer review. It's the brainchild of John Kirpan, our managing editor, and essentially we asked anyone that was interested in mentorship and some formal support for peer review to apply. We received over 40 applicants for 8 to 10 slots, so we are currently figuring out how we can expand this program. And the idea is that people will come out of this with a really structured understanding of how to provide a high quality peer review that enhances the science and reviews that are published in the journal, and ultimately might be a route to joining the editorial board. Looking ahead, we remain laser focused on publishing the highest quality research across cardiac, thoracic and congenital heart surgery, while continuing to innovate how we share that research, discuss it and apply it in clinical practice. AI, switch to digital platforms, social media access has really transformed how we communicate and what we communicate. And I think that the future of our specialty absolutely depends on the highest quality evidence and our ability to put that evidence into practice. Through the Annals, we continue to support that science that advances our field with the North Star of elevating our patient care.